The two main types of hair found on the body are vellus or lanugo and terminal hair. Vellus or lanugo hair is short, fine, and downy. Vellus hair is not pigmented and almost never has a medulla. It is commonly found on infants and can be present on children until puberty. On adults, vellus hair is usually found in places that are normally considered hairless: forehead, eyelids, and bald scalp, as well as nearly all other areas of the body except for the palms of the hands and the soles of the feet. Women normally retain 55% more vellus hair than men. Vellus hair helps in the efficient evaporation of perspiration. Terminal hair is long, soft hair found on the scalps, legs, arms, and bodies of males and females. Terminal hair is coarser than vellus hair, and with the exception of gray, it is pigmented. It usually has a medulla and is easily distinguished from vellus hair by its dark color and coarse texture. Hormonal changes during puberty cause some areas of fine vellus hair to be replaced with thicker terminal hair. All hair follicles are capable of producing either vellus or terminal hair, depending on genetics, age, and hormonal changes. Hair growth, the growth of hair cycles. Hair growth occurs in cycles. Each complete cycle has 3 phases that are repeated over and over again throughout life. The 3 phases are anagen, catagen, and telogen. Anagen, the growth phase. During the anagen or growth phase, new hair is produced. The hair actively manufactures new keratinized cells in the hair follicles. During this phase, hair cells are produced faster than any other normal cell in the human body. The average growth of healthy hair scalp is about 1/2 inch per month. The rate of growth varies on different parts of the body, between the sexes, and with age. Scalp hair grows faster on women than on men. Scalp hair grows rapidly between the ages of 15 and 30, but slows down sharply after the age of 50. About 90% of scalp hair is growing in the anagen phase at any one time. For each specific hair, the anagen phase generally lasts from 3 to 5 years, but in some cases it can last as long as 10 years. The catagen phase, which is the transition phase. The catagen phase is the brief transition period between the growth and resting phases of a hair follicle. It signals the end of the growth phase. During the catagen phase, the follicle canal shrinks and detaches from the dermal papilla. The hair growth disappears and the shrunken root end forms a rounded club. Less than 1% of the scalp hair is in the catagen phase at any one time. The catagen phase is very short and it lasts for 1 to 2 weeks. Telogen phase. The resting phase. The telogen or resting phase is the final phase in the hair cycle, and it lasts until the fully grown hair is shed. The hair is either shed during the telogen phase or remains in place until the next anagen phase, when the new hair growing in pushes it out. About 10% of the scalp hair is in the telogen phase, and at one time the telogen phase lasts for approximately 3 to 6 months. As soon as the telogen phase ends, the hair returns to the anagen phase and begins the entire cycle again. On average, the entire growth cycle repeats itself once every 4 to 5 years. As a stylist, you may hear myths and opinions about hair growth from your clients or another stylist. Here are some myths and facts about hair growth. Shaving, myth. Shaving, clipping, and cutting the hair makes it grow back faster, darker, and coarser. Fact. Shaving or cutting the hair has no effect on hair growth. When hair is blunt cut to make the same length, it grows back more evenly. Although that may take it time to grow back faster, darker and coarser shaving or cutting hair has no effect on hair growth. Myth. Scalp massage increases hair growth. There is no evidence that any type of stimulation or scalp massage increases hair growth. Minoxidil and finasteride are the only treatments that have been proven to increase hair growth and are approved for that purpose for the Food and Drug Administration. Myth. Gray hair is coarser and more resistant than pigmented hair. Other than the lack of pigment, gray hair is exactly the same as pigmented hair. Although gray hair may be resistant, it is not resistant simply because it is gray, and is not more resistant than the pigmented hair on the same person's head. The pigmented hair on the same person's head is just as resistant as the gray. Gray hair is simply more noticeable than pigmented hair. Myth. The amount of natural curl is determined by racial background. Anyone of any race or mixed race can have hair from straight to extremely curly. It is also true that within races, individuals have hair with different degrees of curliness. Hair with a round cross-section is straight, and hair with an oval cross-section is wavy, and hair with a flat cross-section is curly. Cross-sections of straight hair tend to be round, and curlier hair tends to be more oval. But cross-sections of hair can be almost any type, including triangular, and the shape of the cross-section does not always relate to the amount of curl or the shape of the follicle. Hair loss. Under normal circumstances, we all lose some hair every day. Normal daily hair loss is the natural result of the 3 phases of the hair's growth cycle. The growth cycle provides for the continuous growth, fall, and replacement of individual hair strands. Hair that is shed in the telogen phase is replaced by new hair in that same follicle in the next anagen phase. The natural shedding of hair accounts for normal daily hair loss. Although estimates of the rate of hair loss have been long quoted at 100 to 150 hairs per day, recent measurements indicate that average rate of hair loss is closer to 35 to 40 hairs per day. Over 63 million people in the United States suffer from abnormal hair loss, alopecia. As a professional hairstylist, it is likely that you will be the first person that many of these people come to with questions about their hair loss. It is important that you have a basic understanding of the different types of hair loss and the products and services that are available. The emotional impact of hair loss. Although the medical community does not recognize hair loss as a medical condition, the anguish felt by many of those who suffer from abnormal hair loss is very real and all too often overlooked. Results from a study that investigated perceptions of bald and balding men showed that, compared to men who had hair, bald men were perceived as less physically attractive by both sexes, less assertive, less successful, less personally liked, and older by 5 years. Results of a study investigating how bald men perceive themselves showed that greater hair loss had a more significant impact than moderate hair loss. Men with more severe hair loss experience significantly more negative social and emotional effects, are more preoccupied with their baldness, and make some effort to conceal or compensate for their hair loss. For women, abnormal hair loss is particularly devastating. Women who experience hair loss try to disguise it from everyone, even their doctor. Women also tend to worry that their hair loss is a symptom of a serious illness. Studies indicate that women have a greater emotional investment in their appearance. And although abnormal hair loss is not as common in women as it is in men, it is very traumatic. The vast majority of women with abnormal hair loss feel anxious, helpless, and less alive. Many think that they are the only ones with the problem. So the type of abnormal hair loss. Abnormal hair loss is called alopecia. The most common types of abnormal hair loss are androgenic alopecia, alopecia areata, and postpartum alopecia. Androgenic alopecia, or androgenetic alopecia, is the result of genetics, age, and hormonal changes that causes miniaturation of terminal hair, converting it to vellus hair. Androgenic alopecia can begin as early as the teens and is frequently seen by the age of 40. By age 35, almost 40% of both men and women show some degree of hair loss. In men, androgenic alopecia is known as male pattern baldness and usually progresses to the familiar horseshoe fringe of hair. In women, it shows up as a generalized thinning over the entire crown area. Androgenic alopecia affects about 40 million and 20 million women in the United States. Alopecia is characterized by the sudden falling out of hair around round patches of baldness and spots, and may occur on the scalp and elsewhere on the body. It is a highly predictable skin disease that affects almost 5 million people in the United States. Alopecia areata is an autoimmune disease that causes the affected hair follicles to be mistakenly attacked by a person's own immune system, with white blood cells stopping the hair growth anagen phase. Alopecia areata usually begins with one or more small, round, smooth bald patches on the scalp and can progress to total scalp hair loss, alopecia totalis, or complete body hair loss, alopecia universalis. Alopecia areata occurs in males and females of all ages and races, and most often begins in childhood. The scalp usually shows no sign of inflammation. Alopecia areata occurs in individuals who have no obvious skin disorder or disease. Postpartum alopecia. Postpartum alopecia is temporary hair loss experienced at the conclusion of a pregnancy. For some women, pregnancy seems to disrupt the normal cycle of growth of hair, with very little normal hair loss during pregnancy, but sudden and excessive shedding from the 3 to 9 months after delivery. Although this is usually very traumatic to the new mother, the growth cycle generally returns to normal within 1 year after the baby is delivered. Hair loss treatments. Of all the treatments that are said to encounter hair loss, there are 2 products, minoxidil and finasteride, which have been proven to stimulate hair growth and are approved by the FDA for that purpose. Minoxidil is a topical, applied to the surface of the body. Medication that is applied to the scalp twice a day and has been proved to stimulate hair growth. It is sold over the counter as a non-prescription drugs. Minoxidil is available for both men and women, and it comes in 2 different strengths, 2% regular and 5% extra strength. It is not known to have any negative side effects. Finasteride is an oral prescription medication for men only. Although finasteride is more effective and convenient than minoxidil, possible side effects include weight gain and loss of sexual function. Women may not use this treatment, and pregnant women or those who might become pregnant are cautioned not to even touch the drug because of the strong potential for birth defects. In addition to the treatments described above, there are also several surgical options available. Transplants or hair plugs are probably the most common permanent hair replacement technique. The process consists of removing small sections of hair, including the follicle, papilla, and bulb area, from an area where there is lots of hair, usually in the back, and transplanting them into the bald area. These sections or bulbs grow normally in the new location. Only licensed surgeons may perform this procedure, and several surgeries are usually necessary to achieve the desired results. The cost of each surgery ranges from $8,000 to $20,000, and hairstylists can offer a number of non-medical options to counter hair loss. Some salons specialize in non-surgical hair replacement systems such as wigs, toupees, hair weaves, and hair extensions. With proper training, you can learn to fit, color, cut, and style wigs and toupees. Hair weaving and hair extensions allow you to enhance a client's natural hair and create a look that boosts self-esteem.